Hi everyone, this lecture is about emergency and intensive nursing care. First, what is emergency nursing? It's a nursing specialty concerned with the care of patients who are experiencing emergencies or who are critically ill or injured. Ang ER nurses, they work with patients when a diagnosis has not been made and usually the cause of the problem is not yet known. Kaya dapat they should do rapid, accurate physical exam para ma-recognize early yung mga life-threatening illness or injury. At the same time, these nurses use advanced monitoring and treatment equipment para maka-order ng mga diagnostic or laboratory tests, at the same time give medications according to advanced treatment guidelines or standing orders set out by the hospital's emergency physician staff. What is the history of emergency care? Initially, emergency care provided health aid to employees who would experience work-related accidents or health issues because these jobs were hazardous. So may mga accident services, they provided health care by workmen's compensation plans, railway companies, and municipalities in Europe and US by the late mid-19th century. But the world's first specialized trauma care was opened in 1911 sa Kentucky, USA. It was further developed in the 1930s by a surgeon who also equipped police and fire vehicles with medical supplies and trained officers to give emergency care habang papunta ng hospital. Everybody knows what an emergency room is. The terms emergency ward, emergency department, accident department, or casualty department can be used interchangeably. The ER is a medical treatment facility specializing in emergency medicine, the acute care of patients who present without prior appointment, either by their own means or by that of an ambulance. Due to the unplanned nature of patient attendance, yung ER should provide initial treatment for a broad spectrum of illnesses and injuries. Again, as mentioned earlier, some of which may be life-threatening and require immediate attention. In some countries, yung mga emergency departments, they have become important entry points for those without other means of access to medical care. Ang emergency departments ng most hospitals, they operate 24 hours a day, although yung mga staffing level may be varied in an attempt to reflect patient volume. Today, a typical hospital has its emergency department in its own section of the ground floor. Merong own dedicated entrance siya. And the patients can arrive at any time and with any complaint. It's a key part of the operation of an emergency department, and yung prioritization of cases ay napaka-importante dito. This process is called triage. Triage is a French verb meaning trier, at ang ibig sabihin niya, to sort. It refers to prioritization of medical care. Kumbaga, being the worst makes you the first. It may involve the practice of assigning degrees of urgency as to who will receive acute care in cases of large number of patients or casualties, or when there is lack of resources. You do the best for the greatest number of patients. Triage is normally the first stage the patient passes through and consists of a brief assessment, including a set of vital signs as shown in the photo, and the assignments of a chief complaint. Example, may chest pain, may abdominal pain, difficulty breathing. These are the usual. Most emergency departments have a dedicated area for this process to take place and may have staff dedicated to performing nothing but a triage role. In most departments, Itong role na to fulfilled by a triage nurse. Although dependent on training levels in the country and area, other health professionals may also perform the triage, including paramedics and physicians. In this photo, ito ay nangyari noong Taal eruption in Batangas very recently. Triage takes place both in a hospital and community setting, especially during disasters just like this one, volcano eruption, but others also like in typhoons or earthquake. This now is the different levels assigned to patients who come in the emergency room and then when they pass through triage. This will be discussed further during our next discussions. Here we have some of the many lists of trainings that an ER nurse may attend to in order to equip him or her with more specialized emergency care. Merong advanced burn life support, advanced cardiac life support, medical, trauma, usually in cases of accidents, basic life support, emergency nursing pediatric course, mobile, neonatal, health stroke, pediatric advanced life support, pre-hospital emergency care, and the trauma nursing core course. Here are the medical emergencies that will be discussed throughout our course. Patients frequently arrive with unstable conditions in the ER and so must be treated quickly. Again, they may be unconscious and information such as their medical history, allergies, and blood type may be unavailable. Yung ER staff, they are trained to work quickly and effectively even with minimal information. We have cardiovascular emergencies such as MI and cardiac dysrhythmias, respiratory emergencies such as aspiration, airway obstruction, or even asthma, neurologic emergencies such as CVA, head and spinal cord injuries, chest and abdominal trauma, fractures, bites, poisoning, burns, near drowning, substance abuse and withdrawal, violence, abuse and neglect, and even psychiatric emergencies. Now, here is the intensive nursing care on the other hand. An ICU may also be known as an intensive therapy unit, ITU, intensive treatment unit, ITU, or critical care unit, CCU. It's a special department of a hospital or healthcare facility that provides intensive care to patients with severe of life-threatening illnesses or life-threatening illnesses and injuries, which require constant care, close supervision from life support equipment and medication in order to ensure normal bodily functions. An ICU is staffed by highly trained physicians, nurses, and other healthcare workers who specialize in caring for critically ill patients. ICUs are also distinguished from general wards by a higher staff to patient ratio and access to advanced medical resources and equipment that is not routinely available elsewhere. Uncommon conditions treated within an ICU include acute respiratory distress syndrome, septic shock, and other life-threatening conditions. Patients may be referred directly from the ER. So, pag stable na sila from the ER, kailangan silang ilagay sa intensive nursing care or from a ward if they rapidly deteriorate. Or immediately after surgery, maaari ding ilagay sa ICU. Especially if the surgery is very invasive and the patient is at high risk of complications. What is the history of intensive care? In 1854, Florence Nightingale experiences yung mga war experiences niya, they form the foundation for her later discovery of the importance of sanitary conditions in hospitals, which is a critical component of intensive care. She left from the Crimean War, where triage was used to separate seriously wounded soldiers from those with non life threatening conditions. In 1950, anesthesiologist Peter Safar established the concept of advanced life support, keeping patients sedated and ventilated in an intensive care environment. Safar is considered to be the first practitioner of intensive care medicine as a specialty. In response to a polio pandemic, Ibsen established the first ICU in Copenhagen in 1953. In the US, it was in 1955 when Mosenthal, a surgeon, first applied this idea. In polio, many patients required constant ventilation and surveillance, hence the need of an intensive care. And in the 1960s, the importance of cardiac arrhythmia, uh, monitoring, source of morbidity and mortality in myocardial infarction was recognized. This led to the routine use of cardiac monitoring in ICUs, especially after heart attacks. There are many kinds of ICU, different types of ICU. Critical care unit is usually the ICU pero mas nagre-require mas critical or really life-threatening cases. Isolation, intensive care unit when the client needs to be isolated. Burn unit, coronary care unit, neurological, psychiatric, surgical, post-anesthesia or the recovery room, trauma, neonatal, pediatric, or geriatric intensive care to name a few. So here is a photo, an ICU setup with separate beds partitioned by curtains for privacy, with usually a nurse's station situated in a place where beds are easily seen and accessible. Typical equipments in an ICU. Siyempre, may ICU bed. There's the ventilator. May syringe pump. May infusion pump. The physiologic monitor na maaaring magsabi ng vital signs, including heart rhythm, oxygen tank or inlet, suction machine, intubation set, emergency medicines to name a few. Also, may mga special areas din na may iba-ibang equipment. For example, incubator or isolates for newborns. May mga drop light, radiant warmers, or phototherapy. So here is a photo of a client in an ICU. The equipments a while ago are the equipments we see there at the room. Pero pagdating ni patient, minsan may attachments pa mismo kay patient, such as the IV lines with fluids or heplock, CVP lines, the endotracheal tube, chest tube and drainage, may Foley catheter siya, may ECG electrodes, may NGT or OGT, if may wound, may mga bandages, kung may fracture, baka may screws or metals or casts in place, dialysis, cystoclysis, post-TURP, if newborns, baka may UV or UA catheters. So here we see that caring for ER and ICU patients require a lot of skill, knowledge, and attitude. The success greatly depends on how well the healthcare team work together. That's the end of the lecture. Thank you very much.